Mark.
Hello.
I'm Sandra.
Nice to meet you.
I'm going to be your nurse today.
Okay.
I'm going to do an assessment to you. Thank you for visiting our clinic.
Okay.
Go ahead and have a seat. So Mark, how are you feeling today?
I'm pretty good. Feeling a little better than before.
Okay, and I understand that you were recently discharged from rehab?
Correct.
Okay, great. About how long ago were you discharged?
Around about a week.
Okay, terrific. Sorry. I understand you had a stroke, and that's why you were in rehab?
Correct.
Okay, since your discharge, have you been feeling dizzy?
No.
Have you had any headaches?
No.
Okay. I see that you're having some trouble speaking, and tell me about that.
I was recently let out of rehab, and during that time in rehab, I was able to get a lot of my speech back compared to after the stroke, where I could not speak very well
Okay.
at all.
Okay, how does that make you feel?
I'm glad I'm getting better.
Oh, good.
But it's a slow process.
Okay. So, Mark, today I'm going to do a full assessment. What I'm going to do is I'm going to first assess your cranial nerves. I'm going to do a neuro assessment. Okay?
Okay.
Can you tell me what day it is?
Today is, I believe it's 6, 12, 16.
Okay, terrific. And can you tell me your name?
My name is Mark Garcia.
Okay, terrific. Okay, go ahead and close your left nostril and tell me what this smells like.
Orangey.
Okay, close your other nostril and tell me what this smells like.
Cinnamon spice.
Okay, terrific. That tells me that your olfactory nerve is working. Okay, Mark, this is a smelling chart. Can you hold your arm out and read this for me?
Mm-hmm.
Okay. Oh, I'm sorry, you need to cover your eye. Cover your left eye. Do you want me to hold this for you?
Please.
Okay, cover your left eye and tell me read line 6 for me.
8, 9, 9, 1, 5.
Okay, now cover your other eye and read line 5 for me.
8, 9, 9, 1, 5.
Okay, Mark, that tells me that your optic nerve is working and you have 20/20 vision with your glasses. Do you have your eyes checked regularly?
I do.
How often?
Yearly process.
Great. I'm now going to check your ocular motor, your trochlear, and your abducens nerve. Could you please follow my flashlight?
Mm-hmm.
Now I'm going to check your pupils. Okay. That tells me that your eyes are equal, active, and accommodating. Okay. I'm now going to check your trigeminal nerve and your facial nerve. I'm going to touch your face. Close your eyes. I'm going to touch your face, and you tell me where I'm touching it.
Forehead. Left cheek. Right cheek. My chin.
Okay. Can you show me your teeth? Okay. I see you still have you have some facial dripping on your left side. Can you puff out your cheeks? Okay. Okay. I see that again. That is affecting your left side. Now I'm going to assess your acoustic nerve. I'm going to whisper something in your ear, and you tell me what I'm saying.
Merry Christmas.
Okay.
Happy New Year.
Okay. You're correct. Your acoustic nerve is working. I'm now going to assess your glossopharyngeal and your hypoglossal cranial nerves. Could you please stick out your tongue? Stick it out. Okay. And now I'm going to check your GABA reflex. Okay, working. I'm going to assess your vagus nerve by feeling your pulses in your wrists. Okay, and your feet. Terrific. I'm also going to now assess your spinal accessory nerve. Can you shrug your shoulders? Can you lift them up? Can you lift up your left one anymore?
Not too much.
Can you lift them up again? Okay. I'm going to put my hand on your face, and I want you to give me some push against my hand. Okay? Yeah, I see you're a little weak on that side. What about this one? Okay, you're strong on this side. Okay, terrific. So, Mark, that concludes my assessment of your cranial nerves. I am now going to assess your walking. Could you please walk to the door for me?
Mm-hmm.
And then turn around and walk back on your tippy toes. Is that difficult for you?
A little bit, yes, it is a little difficult.
Okay, I'm going to have you hold your hands out, close your eyes and hold your hands out, stand up. Okay, you seem a little off balance.
Sometimes I am.
Okay, and you have a little drift.
Mm-hmm.
Okay, go ahead and have a seat, Mark. Mark, do you use any assistive devices when you're walking?
I'm not using anything right now.
Okay, do you feel like maybe you might want to explore that and maybe start using something to help with your, make it a little more stable?
Possibly that might be a good idea.
What would you be open to? A cane or a walker?
Even just the cane may help quite a bit.
I think so. Okay. I'm going to test your sensory. I'm going to touch you with a sharp and a dull object. You tell me which is sharp and dull. Close your eyes.
Dull. Sharp. Dull. Sharp.
Okay. I'm going to put an object in your hand and you tell me what it is. Keep your eyes closed.
A ball, a round ball.
What kind of ball do you think it is?
It's like a golf ball.
Correct. Okay, I'm going to test you for your coordination. Can you open your eyes and touch your hand to your nose and touch my hand? Do it again, several times. Faster. Okay, terrific. And now I'm going to have you close your eyes and put your arms out. And I'm going to lift one up and down, and you tell me if it's going up or down.
Up. Left down. Left up. Right down.
Okay, terrific. I'm going to test your reflexes.
Okay.
I'm going to use my mallet and scrape the bottom of your foot. Terrific. That shows a negative Babinski. I'm now going to test your Achilles flex. Okay? Very good. Now I'm going to test your patella reflexes. Very good. Very good. Now I'm going to check your radialis. Okay? And your bicep and tricep. Okay, very good.
Mm-hmm.
So Mark, that concludes my neuro assessment. I am now going to assess the rest of your body systems. And I'm going to start with the cardiovascular system. I understand that you have hypertension.
Correct.
Okay. And are you taking your medication as prescribed?
For the most part.
Okay, well, it's very important that you take your medications as prescribed. I understand that you had a stroke caused by AFib.
Yes.
Yes. Were you taking your warfarin as prescribed? From what I've
For
read.
the most part.
Okay, okay. So that is probably what contributed to your stroke, the clot. So even though your stroke was caused by a clot, it's very important to take your hypertension medicine because that also is a risk factor for a stroke. That would be a hemorrhagic stroke. You had an ischemic stroke, but hypertension could cause a hemorrhagic stroke. So it's very important that you take your medications as prescribed. I can give you some literature on the medication, and we can go over that in more depth if you would like.
Okay.
Okay, sounds good. Do you have any chest pain?
No.
Any shortness of breath?
No.
Do you have? Do you feel lightheaded when you stand up?
I stand up very slowly. I'm okay.
Okay. I'm going to listen to your um, listen to your heart. Okay, I don't hear any murmurs.
Good.
I'm going to check your vessels in your neck. Can you please lay back?
Sure.
I'm checking to see the function of your right heart. Your vessels do not look distended in your neck. They look great. I'm now going to check for edema. I don't see any edema in your arms or your legs.
Okay.
At any time, do you ever feel like your arms or legs are swollen?
No, I don't.
Okay. I'm going to check your pulses, your radial pulses. Great. And your PT and DP pulses. Great pulses, Mark. Do you ever have any numbness or tingling in your hands or feet?
Not usually.
Okay, terrific. Let me check for your capillary refill. Great. Everything looks great. I'm now going to assess your lungs, Mark. With your diagnosis of dysphagia, you're at risk for aspirating. Did you suffer from any aspirations while you were in the hospital?
No,
Were you intubated at any time?
I was not.
Okay, do you have a cough?
Not at all.
Okay, have you had a cough recently?
No.
Okay, I'm going to listen to your lungs. Take in a deep breath. Your lungs sound great, Mark.
Good.
Okay. So you don't aspirate. It's very important that you follow along with your prescribed diet, which I understand is a dysphagia 1 diet.
Yes.
Okay, we'll go into more of that later on.
Okay.
I'm going to test your musculoskeletal system. Do your joints hurt?
No, they don't.
Are they tender?
No.
Have you noticed any spasming?
No.
Can you squeeze my fingers? Okay, and now don't let me push your hands down. Okay, now push against my hands. Okay, I still see the weakness on this side. I'm going to do the same thing with your feet. Push against my hands. Okay, and now pull against them. Okay, again, weakness on this side. Do you feel like it's getting better?
It has improved, yes.
Okay, terrific. Mark, have you had any, I'm going to go over your gastrointestinal assessment now. Have you had any weight loss?
Yes, I have.
How much have you lost?
Approximately 25 pounds.
And this has been since your stroke?
That is correct.
Okay, how do you feel about that weight loss?
I don't feel too bad about it.
Why is that?
I was a little heavy
Oh, okay.
prior to the stroke, so I just don't want to lose more than 25, that's for sure.
Okay, so you feel like you've lost some weight that you felt you needed to lose, however, you don't want to lose any more.
That's correct.
Okay, so your dysphagia 1 diet, do you feel like you're satisfied? Do you still feel hungry throughout the day?
Occasionally I do
Okay.
feel hungry.
Okay. Do you have any nausea or vomiting?
None.
Any diarrhea or constipation?
Not at all.
What about any abdomen pain?
No.
Okay.
Feel good.
Let me listen for bowel sounds. Okay. Sounds good.
Okay.
Has your appetite changed a lot since your stroke?
A little bit, but not too much.
Okay. Again, maybe we could follow up with speech pathology and reassess your swallowability, and perhaps maybe advance your diet if the test shows results that you can advance from a dysphagia 1.
That would be nice.
Okay, terrific. How is your? Are you able to urinate? Are you having any difficulties?
No, not at all.
How's your color of your urine?
Light yellow.
Okay. Since you're on a dysphagia 1 diet, that's pureed foods, and so you're not getting very much water, I presume. It's important that you drink you use the thickening agents so that you can drink plenty of water and you don't dehydrate. So it's very important to monitor your urine. Make sure that it's clear, make sure that it's not odorous. If you have any pain, it's very important that you follow up with your physician. Do you have you noticed any blood in your urine?
Not at all.
Any hesitancy?
No.
Okay, great. Do you have any concerns about your ability to urinate?
No, I don't think so.
Okay. So I'm going to go over your skin now. I'm going to assess your skin.
Okay.
So I understand when you were in the hospital, shortly after your stroke, you couldn't move your left side at all.
Correct.
Okay. And were you in bed for how long do you think you were in bed?
Almost a week.
Oh, okay. Did you suffer any skin breakdown?
Not at all.
Okay. Do you have any areas of concern that I'm not able to see?
No.
Okay. I see you have some moles. Do you monitor those?
Yes, I see a dermatologist every 6 months.
Okay, terrific. That's very good. It's good to follow up on that.
Mm-hmm.
Okay. Any dryness?
Occasionally.
Okay.
Not bad.
Again, you want to stay hydrated and moisturized throughout the day.
Okay.
Okay. Let me see your teeth. Okay, and your mucosa looks very moist. Okay, I don't see that you are dehydrated. So Mark, let's have let's talk a little bit. Have you had any mood changes since your stroke?
For the most part, not too much. A little bit, a little down sometimes.
Okay, did you have any episodes of this feeling of down before your stroke?
No, I would say no.
Okay. What do you do when you're starting to feel like that?
I don't do too much. I maybe try to hopefully the feeling will go away over time.
Okay. Do you have feelings of hopelessness?
No, it's just been a drastic life-changing event, I guess you could say.
Has this feeling affected any other aspects of your life, like maybe your sleeping or your interaction with people?
Probably somewhat in different variations. I'm sure it has.
Okay. Do you have trouble sleeping, or do you feel like you sleep too much?
Oh, I sleep more than I used to. That's for sure.
What do you think is causing this? Causing you to sleep more?
I'm a little more tired. Simple, basic things take way more effort than they ever did before.
Okay, so do you feel this feeling of more tiredness is caused by fatigue or depression?
It may be a variation of those two things at times.
Okay. How would you like to address these issues? Do you feel, I don't see that you're on any medications for depression. Do you want to try a more homeopathic avenue or holistic, like possibly meditation or yoga, or do you feel like medication is what you would need?
I think I would try several avenues other than the medications.
Okay.
I think that would be best.
Okay. Do you have any activities that you used to do that you feel that now you're having trouble concentrating on?
Well, I was very active before. I was a golfer. I lived a normal life. It was busy with kids.
Mm-hmm.
And it's a little different now.
Okay. What do you do now? Have you been golfing lately? Have you been able to get back out?
I'm able to golf.
So what do you do now to stay active, to help alleviate the feelings of maybe feeling a little depressed or anxious?
More than anything, just trying to stay active and keep my mind off of things, even though small things. The busier I am, the better.
Okay, great. Mark, at any time, do you ever feel like hurting yourself?
No, I do not.
Okay, terrific. So, Mark, how do you feel like this experience has affected your social life?
Well, the worlds, they're totally different.
Mm-hmm.
It's a different world from then to now, and I have to accept that.
Mm-hmm. Do you tell me how you feel like it's affected your relationships with your family and your friends?
Well, I mean, it's not only changed my life, but it's changed their lives. I need more help, and can't do a lot of things for myself, and that has to involve them now. It's not the best feeling in the world
Mm-hmm.
to have to rely on small things for them to help me do.
Okay. What areas of your social life do you feel like you would like to improve or work on?
Well, I think working on getting better improves not only my family situation, my situation, but my family situation.
Mm-hmm.
So getting better is the number one thing to do right now.
Okay. Well, you seem to be doing a lot better,
Mm-hmm.
and I'm sure that you're going to progress and with your rehab and get back to your old self.
Yes.
So, Mark, tell me about your religious beliefs. Are you
I'm a Catholic.
okay? Are you practicing?
I am.
Okay. How has this experience affected your beliefs, or has it affected your beliefs?
Well, I think it's tested them in a positive and a negative way.
Tell me about that.
I think in a positive light, it's comforting to have my religious beliefs comfort me at times, and sometimes it makes you question why things happen the way they do.
Mm-hmm. Do you have any spiritual path or practice that, other than your religious beliefs, such as meditation or chanting? Is there anything else that you do?
No, prayer is involved
Okay.
in my religious beliefs, so that's probably one thing.
Okay.
Mm-hmm.
Okay. Mark, do you have any other questions?
I don't believe I do at this time.
So, Mark, it's very important that you recognize the symptoms of a stroke.
Mm-hmm.
I understand that your wife was with you when you started having your stroke.
Mm-hmm. Yes, she was.
Okay. Tell me about that.
Early morning, I woke up and my speech had slowed, and she noticed it.
Right away.
Uh-huh.
And did you feel different when this happened?
Yes.
Okay. Okay, I'm going to give you some information and some literature. It's great that your wife did recognize these symptoms.
Mm-hmm.
Those are the number one symptoms. Your facial drooping and slurred speech, inability to speak correctly. I'm glad she was able to recognize that. I'm going to give you some literature though, so you can give it to her and other family members, so they can also help you to help to recognize if this were to happen again.
Excellent.
Okay. Do you have any questions?
No, I think I'm good.
Okay, Mark. Well, you're doing great. I'm glad to see that you're improving every day.
Yeah.
And I'm glad you have a great attitude about this and a positive outlook.
Thank you.
Okay, Mark.
Okay, thank you. Have a good day.
You too. Thank you.